So, the rest of our presentations will now start going into more detail. What Paul did is gave you a good 40,000-foot view of this whole thing, and now we're going to be going into some more of the nuts and bolts of it. So our next presenter is John Kaiser, and John is going to be talking about the differences between Medicare Advantage and the Medicare Supplemental plans. So John? Get up here.
I have near vision, but not distance vision, so, but I think I can work it out. The one comment I'll make too on this presentation for the difference between the Advantage plan and the Medigap plan is in the back of the room before you leave, there's a complete narrative, even more detailed than what I'm going to speak. So as far as taking notes, it's up to you, but there's a very good pass out on this subject that you can take with you. It's also on the website.
And some of the other presentations will be handed out too.
Yes. Okay. And some of this, you know, you'll find that Paul's already covered a little bit. I'll try to cover it in even more detail. Once you've enrolled in Medicare, you need to decide whether to purchase, you're going to purchase additional coverage because Medicare is, of course, going to cover the 80%. Do you want to cover the other 20? You don't have to, but it's certainly advisable. Paul mentioned the Medicare and You booklet. I got to change my slide, I'm sorry. No, it's here. I have to be retrained every year.
I did change your slide.
So now I got to change it back.
There you go.
Okay.
I was trying to help.
Thank you.
I'll stop it.
I need help. Okay. We mentioned that Medicare and You booklet. When I first signed up for a Medigap policy, I thought, well, where the hell's the policy with all the detail of the coverage, like this gal was asking over here? That Medicare and You booklet has very, very good detail on what's covered. Any question you have as far as what's covered, that's a good booklet. And then any supplement you get, if it's covered by Medicare, it's covered by a supplement. So that's key to you. I always wonder, well, is this covered or not by my supplemental coverage? If it's covered by Medicare, then it's covered by the supplement. So you have choices for your remaining coverage to cover the 20%. You've got, of course, the Medicare Advantage plans and the Medigap plans, which I'm going to explain. If almost very few Advantage plans that don't include your drugs. Matter of fact, don't even sign up for an Advantage plan that does not include drugs. Just don't do it. Medigap plans, on the other hand, though, do require you to go out and get a separate Part D drug plan, which I'll talk about in my second presentation. So one covers it, the drugs, and the other one doesn't. For 2021, Medicare charged an annual deductible for Part A, and that's the hospital piece, of $1,484, and Part B services, doctors of $203, and those will probably go up for next year. Now these amounts are in addition to the Medicare monthly Part B premium, which currently is $148.50. And that's deducted from Social Security payments or paid direct if you're deferred taking Social Security. So if you're not taking your Social Security, say you're waiting to age 70, you will have at age 65 start mailing in a payment for $148.50. You will start paying that. The type of plan on the coverage determines how these Parts A and B deductibles get paid or are covered by the policy. It just depends on which policy you get. If Medicare covers a service, then a Medicare Advantage plan or Medigap plan covers the 20% copay, with the amount, though, being dependent on the plan you choose. It's not necessary for spouses to have the same plan or same insurer, but many plans do offer a household discount if you both sign up with the same service or same insurer. So because of differences in age and actually sex, you might find it cheaper not to have the same insurer. It does depend. And as Paul mentioned, these plans, Medicare Advantage plans, and I'm sorry, keep forgetting to move these slides. No wonder you can't follow me. Jeez, sorry. Yeah. Okay, we're good. So the last point on this is Medicare plans and Medigap plans don't cover assisted living and long-term care. Paul already mentioned that.
I changed the word just to mess with you.
You're enrolling in a private insurance plan separate from Medicare. There are no pre-existing condition limitations. You have guaranteed issue at original enrollment or even when changing plans in the future if you're dealing with an Advantage plan, okay? So you never have pre-existing condition requirements with an Advantage plan. That's key. You do have copay, deductibles, and out-of-pocket maximums depending upon the plan you choose. You can get a plan with a zero premium, but your out-of-pocket for copays, et cetera, could be higher. Almost all plans include Part D, and that's where I said I would suggest you do not take a plan that does not include your drugs. Plans can also include dental, vision, and hearing options at a reduced cost. And they also offer free wellness programs, which can mean a free gym membership. So they've made the Advantage plans much more attractive these days. Now, that's not to say you won't pay anything for vision, hearing, and dental, but you'll pay less than if you were just simply going out and buy it on your own. So for a lot of people, they like the Advantage plan because of that feature. Again, unfortunately, you got to kind of price that out. And now many plans, and they're advertising this, they include free in-home care and transportations. But you got to meet certain health requirements. You got to be unable, and you got to have a doctor's note. It's not automatic. So don't be fooled by that one. Most of you, if you're in good health, are not going to qualify for that. So let me give you a little better idea of your choices. The least cost one's going to be an HMO plan, but it very limits you in terms of providers. Your primary care doctor must be in your network, and you need to go to them to get you referred to a specialist, and they have to be in the network. Except in emergency, it does not cover services outside your network. So not a good plan, and also not a good plan if you're traveling either out of the country or even in the U.S., because you may be out of network and you're just not going to be covered. Then there's the HMO POS, point of service plan, and that's like an HMO, except you can be seen by a provider outside your network. The primary care doctor does not need to be in network, but a specialist or hospital out of network will cost more. So you're going to pay more, but you can go out of network. The most popular plan for Advantage plans, I believe, is the PPO plan. And that's got more flexibility but higher cost. You can go to any primary care or specialist but pay less if you stay in your network. So you're still in a network, but it's a little bit broader and you got more flexibility. The network providers can bill no more than negotiated fees, and there's a larger network of providers, so you might find the network outside your state. The PFS plan, it's private fee for service, has no network requirement, but may cover medical care only and not cover drugs. So that's not one that most people would be choosing. The provider must be willing to accept the PFF guidelines and reimbursement fees, or you may incur the cost. And some of your Advantage plans can have a zero premium, but like I mentioned, but their deductibles, co-pays, out-of-pocket max could be higher. It's the disadvantage of Advantage plans is trying to price them out, to be honest with you. You can choose an MA plan based on the type of healthcare service you need and their frequency. The pricing is not based on your age, your sex, or your health, unlike Medigap, which I'll discuss. And as a rule, higher premiums generally mean lower out-of-pocket costs. Your choice of an MA plan determines your coverage and cost. I think they're growing, but I think maybe 40-some% of people choose, so it's almost 50% of people choose MA plans. The percentage on Medigap, I'm going to say, is around 40. And then you got the people who have a spouse working or something like that. But because of what they've been offering, Medicare plans are growing, so you just have to decide for yourself. And I'll speak more to that. After initial enrollment in MA plan, you have 12 months. So if you're in an Advantage plan, you do have 12 months to switch over to Medigap and still have guaranteed issue. So that's important. If you get in the Medicare Advantage plan, you don't like it, you don't think it's going to work, you still can get into a gap plan. After age 65 or when first eligible, you can join or switch plans during the annual enrollment period. Now that's coming up October 15th to December 7th. You can also change plans. Yep. Just holler at me. You can also change plans during the open enrollment period during January 1st to March 31st. So you can change plans, but you can't, and you can disenroll, but you can't sign up for new. You can't go into a new plan. Okay. But if you want to get out of an MA plan and move to a Medigap plan, you could be subject to medical underwriting, and I'm going to explain what medical underwriting is shortly. Or you can change the no plan if you want and just disenroll. However, you cannot move from a Medigap plan to an Advantage plan during this period. You can only do that October, December, the days I mentioned. With Advantage plans, you receive only one billing from insurer, none from Medicare. Okay, now I'm going to talk about Medigap plans. As I mentioned before, Medicare is paying the 80%, and you're trying to cover the other 20, and you will pay the Medicare Part B deductible of $203 up front, $203. In the past, there was an F plan that covered the $203. Presently, there are no Medigap plans that cover Part B. Most of them cover Part A, which was at $1,400, but no gap plans now cover the Part B. So the first $203 that Medicare bills, you will pay with a Medigap plan. At age 65, when you first become eligible, you have guaranteed issue, which means no pre-existing conditions. After your initial enrollment, you have 6 months to change the Medigap plan. So if you get in a Medigap plan from the get-go, you do have 6 months with no underwriting to switch it. 6 months. Yes?
What is the definition of pre-existing condition?
I'm going to do that right now. I'm going to explain pre-existing conditions in a second. Okay, that was the question. Unless you enroll at age 65 when you're first eligible, the insurer may deny you coverage or charge a higher premium due to pre-existing conditions. If you want to enroll later in a Medigap plan or change your existing plan, you may be subject to medical underwriting. So medical underwriting is what's required if you don't have, you're not excused from pre-existing conditions. Medical underwriting is a review of your medical history. You're required to answer a series of medical questions, including a discussion of the prescription drugs you take and why. Quite often, when you name that you're on a drug, say for diabetes, then that's going to bring up the question, do you have diabetes? If you're on a drug for AFib, so you're going to get all these questions. It's not quite as intensive as trying to buy a life insurance policy, but you are going to get questions. And most of the consultants can pre-screen you and ask you these questions and say, I don't know, we'll try, but I don't know if you'll be able to get a gap policy. This is, again, if you're doing it later and not doing it when you're first eligible. Certain conditions related to the heart, cancers, and pending or recent surgeries can disqualify you. If you had a recent surgery, they might say you got to wait a year, like say you had a hip surgery. They might make you wait. And you're playing after initial, okay, that is why it's so important to make the best choice for yourself when first eligible to enroll with guaranteed issue. Medigap plans have no open enrollment restrictions, so you can switch plans, you can, at any time in the year. Again, though, you could be subject to the underwriting if you try to do it after 6 months. Okay. I have to be retrained every year. Okay. So if you're moving from an Advantage plan, I'm on the last bullet. If you're moving from an Advantage plan to a Medigap plan, make sure you can get out of the Advantage plan. because there are controls there. So while you can move to Medigap, or if you're going from an Advantage plan into a Medigap plan, there's only certain times of the year, October and December, and then January through March, that you can do that. And Paul talked about plan codes, and they're standardized amongst the insurers. That means every insurer's plan code has the exact same coverage. The plan you choose will determine your premium and copays. Plan G is now very popular, with the only payment being the Medicare Part B deductible of $203. So once you pay that $203, everything is covered for the rest of the year. Other plans have higher copays but lower premiums. I'll use N as an example. N's a very good plan. What you pay there is $20 a doctor visit, $50 if you go to emergency. So if you're someone that goes to a doctor a couple times a year, your physical maybe, of course you can't know in advance how often you're gonna go, but if you're someone that doesn't go very often, you could go to an N plan and save $30, $40 a month versus a G plan. So it's your call. Again though, if you get into an N plan and later want to move up to G, you could be subject to underwriting. Depends on the insurer. As been mentioned, Medigap plans do not cover dental, vision, or hearing. They do cover skilled nursing if you meet certain requirements. Example, you've been in the hospital and they say, hey, you got to go to a nursing home for some PT, or like Paul mentioned, that is covered. Most states allow you to enroll or change Medigap plans anytime, but if in an MA plan, Advantage plan, switching to a Medicare, you can only disenroll during special periods. Therefore, if you have an MA plan, make sure you can leave the MA plan before you go signing up for a gap policy, Medigap policy. Make sure you can get out of the one you're in. And never, ever cancel an existing policy without written proof of your new policy from the insurer. Don't do that. Medigap plans do not cover Part D drugs. When you enroll a Medigap plan, you must sign up separately for Part D, which I'm going to talk about later, or you can be penalized permanently 10% of the national monthly premium cost. So as an example, it's 2% a year, and right now the national average is $33 for a plan. So that works out to about $4 a year per month for every month you wait. So to make it simpler, if you waited 10 years, you'd be 10 times 4, $40. When you finally do sign up, you pay an extra $40 a month because you waited 10 years. 5 months, 5 years, you'd be $20. So there is a penalty there, and that's why Paul mentioned that if you're not on any drugs, go get a plan for $12, then you're covered. That way too, if for heaven forbid you came down with a serious illness that needed maybe a expensive chemo drug, you cannot enroll till October 15th. So you'd lose the bet. You'd lose the bet. Several Medicare plans do cover foreign travel. They have a deductible, but MA plans and Medicare do not cover foreign travel. So that's an advantage for Medigap plans. That's essentially my presentation. In more detail, and maybe in nicer order, there's a handout that explains all this. And it's on the website, but it's also, we thought it was important enough to give you a pass out of that before you leave today. So I guess I have time for questions.
Just one, you have a final slide. Go one more.
All I have to do is turn the page.
I have a question.
Go ahead.
Plan F, should I stay on it or get off it?
The problem with Plan F is that it's closed to anyone who turns 60, is not 65 as of January 2020. You obviously know that. The problem is there are going to be no new young people coming in, so the experience rate for a Plan F will be higher than a Plan G. And generally speaking, if you take your premium for Plan F and compare it to a G, the G203 divided by 12 months is $16. So if a G plan is $16 cheaper, it's a better bet. So my answer to you is, if you can pass underwriting, go to G. Okay? I've got a G plan, and I'm paying 170, I'm 78. And my wife's paying about 145, she's younger. If you're just getting in, the guys will probably be around 120, the women will be a little bit less than that. Pardon? 120, around 120, I haven't looked at them lately, but 120, 127 for the guys.
A year or a month?
Oh, I'm sorry, per month. So but again, it's based on age, and it's based on sex. And it's also based on where you are in Michigan. If you're up north, it'd be less money. So if you're in a metropolitan area, it is more expensive. Did I answer your question, though? Okay. So I know it's a lot to absorb, and again, there's more detail on the website. It's labeled Understanding Medicare Advantage and Gap Plans. Again, there's a pass out on it. So, and even though I think I have significant knowledge on this, I learn more every day, and I learn a lot from the consultants. The information on our consultants is on your agenda, and it's on our website, and you're making a mistake if you don't use a consultant. Part D, as I'll explain shortly, you could do on your own, but definitely for Advantage plans versus Medigap plans, you want to use a consultant.
A quick question from the webinar.
Okay.
I will enroll for Medicare in 2022 and buy a Medigap plan at that time. When my spouse needs a Medigap plan in 2 years, do Medigap providers lump our two plans together and provide a discount, or are we treated separately with no joint discount?
They probably would, I think they would be eligible for a discount if that insurer offers what they call a household discount at the time she signs up, you know.
Can we defer to one of our consultants there?
Yeah, that's a good question.
Take one of the microphone.
That's a good, yeah. That should be yes.
Generally, if the spouse signs up later in the year, a couple years later, then at that time, usually for most carriers, and we're a little different, but you can apply for the household discount, and you should be able to find one that'll accept that household discount. So at the time that the later spouse becomes eligible, you can probably get that.
Yeah.
But it is different for each company.
And depending on the one who's already enrolled, their health, they could even change insurers to match their wives. You know, you just got to look at the whole thing. Yeah.
Yeah, each carrier is different, but when you apply, if you do it online or if you do a paper app, when you go to sign these spouse up, you have to have the ID number of the prior person that signed up, and then you put that on the website when you log in. If you're doing an online app, you have to put that person's information in there, and then the two carriers will automatically sync. The carrier will automatically sync those together and give you the discount if there is one available by that carrier. And it usually takes about 30 days for the second person to get that discount. So if your premium is already going through that month, don't count on it'll be that, but you will get a rebate back to when the two of you actually signed up.
But each of you would be able to help know whether that carrier provides that discount, right?
Correct.
Even before the application is made.
Yeah, we'll tell you exactly which carriers are going to give you a discount. The average is between, sorry. Yeah, we'll actually show you the discounts with and without the discount, and then we'll tell you what the discount is. It ranges usually between 5 and 7% for a two-person discount.
Now, for that house, you have to be married or live in the same house together.
Yeah, you have to be married.
You have to be married.
Spousal discount.
Okay. Now, do both of you get the spousal discount, or does just your spouse get the discount?
No, you both get it. Yeah, so if one person rolls when they're 65 and you have a 63-year-old, and then all of a sudden they become 65, you both get the discount. That's what I was saying is the person that's turning 65 will get it right away. The person that was 65, about 30 days later, it'll catch up, and then you'll get that credit back 1 month. Yeah.
Sorry for not moving the slides very well.
So, you can see this is a very complicated issue. There are lots of little details, and you can do this and you can't do that.